How did cancer screening methods change over time? Imagine a time when catching cancer early was almost like finding a needle in a haystack. Over the past century, cancer screening has undergone remarkable changes, transforming how we detect and prevent reproductive cancers and others. It all started with simple observations and evolved into sophisticated tools that save lives today. The first major breakthrough was the Pap test, developed by George Papanicolaou in the 1920s. Originally, he was studying menstrual cycles, but he discovered that abnormal cervical cells could be seen under a microscope long before they turned into invasive cancer. At first, many doubted its usefulness, but by the 1960s, health organizations recognized its value. The Pap test allowed doctors to spot precancerous changes early, leading to a dramatic drop in cervical cancer cases and deaths. This was a huge step forward because it shifted the focus from treating advanced cancer to catching it early when it's most treatable. For breast cancer, screening methods took longer to develop. It was in the 1960s that mammography, which uses low-dose X-rays to image breast tissue, was created. By the late 1970s, the American Cancer Society recommended mammograms for women over 40. Today, mammography remains the gold standard for breast cancer screening, helping detect tumors too small to feel and catching cancer early. When it comes to testicular cancer, the story is different. There is no standard population-wide screening test like the Pap or mammogram. Instead, awareness campaigns encourage men to perform regular self-examinations because testicular cancer is often found early through physical checks. Its accessibility makes early detection more straightforward, but ongoing education remains key. Screening for other cancers also advanced significantly. Colonoscopy, introduced in the late 1960s, allows doctors to look inside the colon and remove precancerous polyps before they turn into cancer. This method not only detects cancer early but also prevents it altogether, which is a major shift in approach. Overall, the evolution of cancer screening has been about moving from only finding tumors when symptoms appear to identifying cellular changes and early lesions before symptoms develop. This shift has been especially impactful for reproductive cancers like cervical and breast cancer, turning what was once deadly into largely preventable and treatable diseases. Today, guidelines recommend regular screening for cervical, breast, and colorectal cancers, reflecting decades of research and technological progress. In summary, cancer screening methods have changed by introducing microscopic examination tools like the Pap test, developing imaging techniques such as mammography, creating endoscopic procedures like colonoscopy, and emphasizing physical exams and awareness for cancers like testicular cancer. These advances have helped detect cancers earlier, improve survival rates, and save countless lives. Remember, always consult healthcare professionals for personalized advice and screening recommendations suited to your health needs.